Then I pointed at it and say, hey friend, hard enough or not? And he said, still not hard enough. Heads up, these are some hard questions on erectile dysfunction. I won't go soft on you. Or maybe you are asking for a friend. Hi, I'm Dr. Tan. I'm the Medical Director at Dr. Tan Medical Center in Novena Medical Center. I've been in private practice for the past 15 years, focusing mainly on men's health. So what is men's health, you might say? The best summary I've ever heard is basically we're the men's gynae. So we take care of everything from sexual health, including things like erectile dysfunction, premature ejaculation, circumcisions, all the way to fertility problems and prostate issues. All these natural cures out there, pomegranate juice, garlic, onions, and the very famous Tongkat Ali. Can it cure ED? Should I just go onto the internet, buy these things and take it for myself? I would first say, all of these things are harmless. If you try them and they work for you, fantastic. Keep taking them, more power to you. But let's look at the scientific evidence behind such supplements. Let's look at Tongkat Ali first, since it is the most famous locally. It is derived from this herb called Uricoma longifolia. There were actually studies done in a Malaysian university on animals. Now, can this be extrapolated to humans? Really don't know. As far as I know, there are no human studies. But like I said, if you take it, you find that it works, it's harmless, please continue taking it. But one word of caution, because I did see a patient who sourced Tongkat Ali online. Unfortunately, the medicine that he got was actually laced with a prescription erectile dysfunction drug. So he felt like it worked greatly, but he was getting side effects. So when I actually looked at the medicine he was taking, I found that it actually contained a prescription ingredient, and this, as you know, can be quite dangerous if it's not properly controlled by a doctor. Okay, are penis pump sex toys or treatment for erectile dysfunction? Well, really they're both. Let's look at how a penis pump works, right? It's basically a rigid plastic tube they put over the penis, create a vacuum around the penis. So what happens is blood is then drawn, because of the vacuum pressure, drawn into the penis. And then what some patients would do is they will put a constricting device at the base of the penis. Basically looks like a really tight rubber band, and this prevents the blood from flowing back down, and therefore blood is retained in the penis and the erection is maintained. Doctors do prescribe penis pumps in certain situations to help with erectile dysfunction. Number one, using penis pumps without the constriction ring. Any part of the body that doesn't get fresh blood flow will become unhealthy. So if you put a really tight rubber band at the base of your finger and left it there and there's no blood flowing to the finger, what happens to the finger? The finger probably would die off, right? So same thing, if the body is not pushing fresh blood with oxygen and nutrients into the penis, then the tissue of the penis will start to get unhealthy. Some doctors will actually advise regular use of the penis pump just to get fresh blood and nutrients into the penis without using the constriction ring. So think of it as like physiotherapy for the penis. And yes, like how we described just now, how to use a penis pump about getting it erected and then using a constriction ring is also a so-called treatment or cure for erectile dysfunction. But these days, given the much more convenient options that we have, like the tablets, this form of treatment really has fallen out of favor. Is shockwave therapy painful? I know the name sounds very scary, so let's give it a less scary sounding full name. The full name is low intensity electroshockwave therapy. So maybe that sounds better. The fact is, because it is a low intensity shockwave, it is absolutely completely painless. Low intensity electroshockwave therapy is shooting painless shockwaves into the penis to open up the blood vessels of the penis and to also stimulate the body to create new blood vessels, a process we call vasculogenesis. So the question is, any advice for men who suffer from ED or erectile dysfunction who are afraid or embarrassed to see a doctor? Don't be. ED is a symptom of a disease. If your throat hurts, if your knee hurts, if your tummy hurts, you have no problem seeing a doctor. Erectile dysfunction is a symptom. It's not about sex. If you have erectile dysfunction and you tell yourself, I'm old enough, I don't intend to have any more sex, fine. that is a perfectly logical lifestyle choice you made for yourself. But it doesn't mean you should ignore the symptom that could be a sign of a more serious underlying disease. So if you found this interesting and you want to see more, please like, share, hit that subscribe button. And if you have any more questions, even harder questions, leave it in the comment sections below, and I will try my best to get back to you as soon as possible.